Good morning. I would like to talk to you today about osteoporosis. Osteoporosis is a skeletal disorder characterized by low bone density and an elevated risk of fracture. While it is more prevalent among older individuals, women more than men, it affects individuals of all ages. Fractures associated with osteoporosis, specifically fractures of the spine and hip, are a significant cause of disability, mortality, and healthcare utilization. However, they are largely preventable. 1.5 million Canadians 40 years or older have been diagnosed with osteoporosis, and it is treatable. There are two types of osteoporosis, primary and secondary. If you click on the word video and start it at 1 minute and 55 seconds and stop it at 2 minutes and 46 seconds, it explains the two types of primary and secondary. To diagnose osteoporosis and assess your risk of fracture and determine your need for treatment, your doctor will most likely order a bone density scan. This exam is used to measure bone mineral density. It is most commonly performed using dual energy X-ray absorptiometry or bone densitometry. The amount of X-rays absorbed by tissues and bone is measured by the DXA machine and correlates with bone mineral density. The DXA machine converts bone density information to your T-score and Z-score. The T-score measures the amount of bone you have in comparison to a normal population of younger people and is used to estimate your risk of developing a fracture and need for drug therapy. Your Z-score measures the amount of bone you have in comparison to those in your age group. This number can help indicate whether there is a need for further medical tests. Risk factors and prevention. Clinical practice guidelines outline risk factors that help to identify people who should be assessed for osteoporosis and fracture risk. These include advanced age, previous fragility fracture, fracture associated with low bone density, parental hip fracture, cigarette smoking, heavy alcohol consumption, being thin, body weight under 132 pounds, prolonged use of glucocorticoids and other bone depleting medications, certain disease states and genetic disorders associated with bone loss. Furthermore, they provide recommendations regarding lifestyle approaches such as calcium and vitamin D intake and physical activity, in addition to the use of medications for the prevention and management of osteoporosis. Treatment. The primary goal of treatment is to prevent or slow bone loss and reduce the risk of fracture. So you can use drug therapy. So your doctor may recommend one of a variety of drugs to help you with osteoporosis. Those include the 4 listed on the screen. You can also use bone formation therapy, which help you to build up bone. If you have osteoporosis, preventing falls and fractures is an important concern. Some tips on reducing your risk include doing regular weight bearing, balance, and strengthening exercises, having your doctor review your medications to ensure none cause dizziness or sleepiness, which can lead to falls, having your vision checked regularly, making your home safe, for example, by removing throw rugs, using non-slip mats in the shower, and wearing shoes inside. Wearing hip protectors, pants or underwear that have padding in them to protect your hips if you do fall. And these are my references. Thank you so much for taking the time to listen to my presentation today.